Yeah.
You study hospitality, right?
Yeah, so do.
So I have this, my back is kind of hurting, and I have a itch in my throat. I was wondering if you could help me with that.
Molly, you know just as well as I do that hospitality does not mean hospital. And I do not study to become a doctor.
Oh, you're right. Well, if you think about it, you can have hospitality in any realm, even hospitals and the overall healthcare industry.
You're absolutely right, Molly. And with that, we would like to welcome back Dr. Stowe Shoemaker to share more about it with us on a keynote of his recent book, Hospitable Healthcare.
I loved what he had to say about the hospitality-centric classes in his earlier fireside chat. I can't wait to hear more from him.
And without further ado, let's dive into the world of hospitable healthcare.
Great job.
Thank you very much. I'm glad you decided to stick around. So that means I didn't do too badly the first session. Or are you required to stay? So I'm going to talk about hospitable healthcare. And you may kind of wonder, how can I, being a hospitality person, talk about hospitals? Well, I was very fortunate. Before I became dean, I worked at the University of Houston for 8 years. And while I was at the University of Houston, I held a joint appointment at University of Texas MD Anderson Cancer Center Hospital. And they actually brought me in to help them figure out how do we make patients, how do we bring hospitality principles into healthcare? And the research I did, we discovered through my wife, who did her PhD at Texas A&M, that they weren't patients, they weren't customers, but they wanted to be thought of as loved family members. So the whole question was, how do we make people at MD Anderson feel like loved family members? So I had this joint appointment. For 2 years, we published a bunch of papers that we published in the Journal of Clinical Radiology and things like that, that really kind of led this together. A few years ago, many years ago, I had written a textbook on marketing, hospitality marketing. It was kind of the Betamax of marketing textbooks. And you don't understand that analogy, but years and years ago, Betamax came out, and then the VCR came out. Betamax was the better technology, but never got adopted. And that was kind of like my marketing textbook. But one of the people who helped me on my textbook was a gentleman named Peter Yesevich. And so I ran into Peter at a conference, and I said, "What are you doing, Peter?" And he said, "Oh, I'm working for Cancer Treatment Centers of America." And I said, "Oh, I'm working at MD Anderson." So then a few years later, he called me up and said, "Hey, let's write a book to bring hospitality principles into healthcare." Because we had noticed that looking at this chart, you can see, now this is American data, that this is the blue is the ratings for hospitals in terms of overall customer satisfaction, and here are hotels, Marriott and Hilton. Hospitals were much lower. And everybody's had a terrible experience in a healthcare situation. And probably many of you have said, "Gee, why can't they do it like they do in hotels or restaurants?" So we thought, yeah, we should write a book. But we didn't want to be just two people with an opinion. So what we did is I'll talk about the research we did, but basically you can see we talked to people who had visited a hotel, gone to dining out, visited a hospital, a walk-in clinic, or a physician's office, and you can see that overall satisfaction much less in the healthcare setting than in the hospital, than in hospitality setting. So we ended up writing this book that came out a year ago. It's available on Amazon. We have it on a Kindle version, and we also created an audio version. But we didn't, again, as I said, we didn't want to just be two people with an opinion. So we started off doing what you've learned in probably some of your classes is qualitative interviews. We talked to some of the leading hospitality companies, Ritz-Carlton, Hilton, the Dorchester Collection. We also talked to Open Table in terms of distribution, Caesars, Four Seasons, etc. But then we also did some work with healthcare situations. So Geisinger Health is located in Pennsylvania, but they're all across. They recently formed an agreement with another company, so they're all over the country. But we also talked to the Mayo Clinic, which is very famous in the States, as well as Cleveland Clinic and the Barrel Institute, to really figure out what is it that's happening in the hospital setting that's making people feel like loved family members. And then, as I briefly mentioned, we surveyed 1,200 adults across the US. And we did this prior to COVID. And they had to have visited one of those locations, which I mentioned. And we asked them to rate 24 common service touch points that related both to hospitality and to healthcare. And you can see I have all these attributes right here. And again, we asked on a 1 to 10 scale, like 1 being not at all important and 10 being very important. And you don't have to take pictures of these slides because I'll have them available to whoever wants them. So you can just take the slides with you. But what was critical in this is we also did what we wanted to see, because we asked what's important, but then we asked customers how well does each of those attributes describe each of those 5 components. So in your classes, you all learned about the GAP model of service quality? Yes? Right, the GAP model meaning the difference between importance versus performance. Obviously, if performance exceeds what we expect, we're happy. If it equals what we expect, we're happy. But if it decreases, we're unhappy. So we wanted to find out really where are there really gaps between hospitality and healthcare. And of course, we found that there were gaps. And essentially, we divided these, what we called the hospitality deficit, into kind of like 5 categories. The first was knowing and understanding the cost of services provided. One of the things that we find in the state, at least in the United States, and again, I apologize, all this research is based on US, is that no one really knows what healthcare costs, right? Some of it's come with insurance. You go to the doctor, and all of a sudden you get a bill. I went in one time for something. I was told it was going to cost X amount of money, and then about a week later, I get another bill from the person who put me to sleep before they did the operation. And I never knew that that was even not included. So that was the biggest thing, is the invoice bill I receive is easy to understand. No one in America can understand what their bill is. They don't know how much they have to pay before they receive the service, and the invoice was inconsistent with their expectations. That never happens in hospitality, right? We know what we're going to pay, right? We know what the room rate's going to be. We know what the extra charges are going to be and all that. So it's very simple. In healthcare, we don't have any idea. So it's a huge gap. The customer appreciation. In hospitality, we're constantly thanking people, right, for visiting us. In healthcare, when was the last time your doctor said to you, "Thank you for coming to see me today"? When was the last time the nurse said, "Thank you very much"? Right? We found it never happened. The reception, okay? Obviously, in hospitality, we're great at welcoming guests, right? We have create great welcoming environments. When we looked at disconnect between healthcare, the arrival experience is welcome. In healthcare, not at all, right? If you've ever been in a healthcare situation, typically what happens, a person's sitting looking at their desk, and they say name, insurance card. They don't even look up. They don't even welcome you. Okay, the arrival environment is welcoming. Okay, in the United States, you go into many hospitals or healthcare situations, and you can read the magazines that were a year ago, because they're just kind of spread all over the place. The people I interact with make me feel welcome, and the people I interact with are eager to serve me. The gaps here show that hospitality, we're great at it. In healthcare, we're not great at all. The service logistics. I can make an appointment or get a reservation when I want one. Obviously, in hospitality, it's very easy to get a reservation, right? Unless, of course, we want to go to John's in DC, then we have to wait forever to get into those 16 seats. But mostly we can get a reservation whenever we want to. And the check-in process, checking into a hotel is very easy, right? Because they know we're coming. Usually we fill out all the information before we arrive. Okay? In the United States, when you go to your doctor's office or you go to the hospital, even if you've been there multiple times, they give you a stack of paper to fill out. And you probably filled that paper out the last time you were there, but we don't keep any of those records, right? So it becomes checking process becomes very inconvenient. And service assessment and recovery. Think about in hospitality, we're very good about saying we're unhappy. That was mentioned earlier, right? We may have a terrible airline flight. We don't say anything, but we stay in a hotel or a restaurant, we complain. And usually in hospitality, we're very good at resolving disputes, right? The provider in hospitality, we definitely try to make you feel satisfied, okay? And we're pretty good about expressing our dissatisfaction. But in healthcare, have you ever said to your doctor, I don't like the way you're talking to me. Can't you be a little nicer? Right? Usually we're just sitting there like panicked that they're going to find something wrong with us. And they never really ask us about our experiences. Right? So what we do is we go home and then we complain to everybody about our doctor or our hospital. Right? And so all these gaps are occurring. And the question really began then is, well, what can we do as in healthcare to improve that overall experience? Because when you think about it, and we really understand it, healthcare is a business. And hospitals, even though they're nonprofit, have to make money. And the way medicine works in the United States is pretty much anybody can get care anytime. And because Medicare will cover it or Medicaid. But Medicare does not pay any money at all. So hospitals and doctor's office, everybody wants to go after what they call the self-payer. Those are people who will pay their own money for their procedures, okay? Because it's more lucrative, so they can use the money they earn from that to discount the Medicare or the other things they have to pay. Now, the other thing that's happened in healthcare in the United States is the government has said, well, when we're paying you for Medicare, we're not going to pay you 100% of the fee. We're going to only pay you a certain percent based on how satisfied your customer is. So I think it's around 2 to 3%, they will hold back based on customer satisfaction. So now suddenly hospitals have to get their customer satisfaction scores up so that they can get the full revenue, right? So there's this real dichotomy of how do we create incredible healthcare. Many years ago, Disney wrote a book called If Disney Ran Your Hospital. And to be honest, I thought it was a terrible book because most hospitals don't have the revenue that Disney has, right? A lot of time, executives from Four Seasons or one of my former students from UNLV worked for Ritz-Carlton for years. Now she's working in healthcare. But it's a very different approach between serving very wealthy people and serving everybody else. So when we wrote this book, we wanted to write a book that we're not just going out how to take care of really wealthy people, but how does a healthcare system take care of everybody? And that's why when we were at Hilton, we didn't talk to them about the Waldorf Astoria. We talked to them about Hampton Inn, their lower brands. How do you provide great service at a Hampton Inn so that we can provide that same processes in the healthcare system? So please ask questions as I'm going along. But make sense so far? So obviously the success in hospitality is a direct result of efforts developed, again, over time to deconstruct the customer journey into discrete complementary disciplines and to create a culture that addresses each of those disciplines. So we had to figure out, we took all this data, we analyzed, and we said, okay, how do we make this work in healthcare? And so we came up, we called the payer model. And that's kind of a play on words because in healthcare in the United States, they talk about payers, meaning who are the people that are actually paying the money. It's the insurance companies, it's the individual, et cetera. So we came up with what we called the payer model. And the idea is, how can we use principles in hospitality to improve healthcare? Now, what I'm for the rest of the presentation is I'm going to not just go through all the data that we discovered to show you, yes, that there is a disconnect within each of these areas, but what I'm going to do is show you how to use hospitality principles in healthcare. So a lot of what you'll see, you'll go, oh yeah, I learned it in my class about the GAP model. I learned about, the service-scape and all that kind of stuff. So this is the kind of presentation I would give to like MD Anderson. So I went down and I spent a day with MD Anderson, which is the leading cancer hospital in the world. I worked at Baylor College of Medicine, and I worked with a couple hospitals in Houston, and obviously my co-author, a gentleman named Peter Yesevich, has also been presenting this. So I'm giving you examples of how we use this payer model to improve overall patient satisfaction in a healthcare situation, as compared to giving you like lots of data. Now the book, if you're interested, it's available on Amazon. You can get it on the Kindle version, so it really doesn't cost anything. But it goes through in detail all the different numbers of what we're discussing. So the payer model is broken into kind of 5 areas: prepare, anticipate, engage, evaluate, and reward. So in the first one, it's prepare. So the idea is, how do we understand the purchase patterns, preferences, profiles, and save this information so we can make it easy for the guest. We prepare for the guest's arrival. That's what we do in hospitality, right? We send a person out, thank them for their reservation, let them know when they're coming. We give them all their information so when they arrive, they know what happens. So what we recommend for healthcare is to confirm a reservation and create a positive anticipation about what to expect. Okay, and then we work with other departments. Now, I have a friend who's at MD Anderson, and basically because I'm one of his caretakers, so to speak, I have access to his complete records. So I get sent a note that says, hey, Marco has an upcoming visit yesterday. Please complete your pre-visit information prior to your appointment. And you click on that link, and it takes you to everything you need to fill out before you arrive. So when the patient arrives, he doesn't have to sit there filling out all that stuff over and over again. Just like in hospitality, we fill out all the stuff before we arrive. The second thing we do is we do journey mapping. Okay, basically, maybe you did this in some of your classes, where you take the time the guest begins to walk to park in the parking lot, to the time they get to the room. What are all the steps they have to do? And how do we make sure that at every step in that journey, we've created an overall experience, right? Because every time in that journey, a guest runs into a staff member, that becomes a point of interaction. You learned in your classes, that becomes the moment of truth. How do we make that moment of truth worthwhile, right? We also do statistical modeling to predict the demand, right? You work in a hotel. How many desk clerks do we have working at a specific time? Well, we use statistical modeling. I wrote an article in the Journal of Clinical Radiology using a distribution. Sounds like a fish distribution, but it's one of the distributions in statistics that allows us to say, what's the probability X number of people will be at this point in time, and we can schedule that. We should also use demand management and basically behavioral economics, dynamic pricing. You're going to hear about later this afternoon. But essentially, we give the same quality of service, we just give it at different points in time. So not many hospitals are taking advantage of this yet, but I think that's going to be the future in healthcare. And you think about in a cancer situation, or really any situation where anybody has to go under a magnet to get any kind of scan, whether it's a CT or MRI, very expensive piece of equipment. And how do we have a huge demand. So what do we typically do in hospitality? We spread out demand by changing the price. So what I always tell them is, tell me when you want your scan, and I'll tell you what you have to pay, or tell me what you want to pay, and I'll tell you when we have one of those machines available. just like what we do in hotel rooms, right? So how do we bring in demand management into healthcare so we can spread out demand? And then we also want to think about in healthcare, how do we develop a customer relationship management program? So we have an idea that we can predict our demand, when customers are coming, what type of behaviors they're going to be getting, so we're never surprised, right? In hospitality, we're very good about knowing who's coming, when they're likely to come, and we plan accordingly. Okay? So that's the prepare part of the model. Then we have the anticipation part, number 2. Think about going on vacation. There's a high amount of anticipation about that, right? You're very excited. But if you're like me, you're going, oh my God, what could go wrong, right? Because it's service. We're scared to death that things could go wrong. So what do we do in hospitality? We send people a note, let them know they're coming. We welcome them. They get excited about their visit. So we reduce that anticipation. That's what we recommend in this study too. The goal is to reduce the anxiety. So how do we think about ourselves in the mind of the patient, not in the mind of the staff? Okay, and again, don't use the word patient, but use the term loved family members. So we issue a pre-arrival confirmation to the appointment to introduce the staff they will meet upon arrival, any requests or things like that. And again, I showed you earlier the form from my friend Marco that was sent to me. You click on the link, tells me what time is the appointment starts. There's all these other things with all this information that allows me to understand, or allows the patient to understand all the steps he has to go through before he or she even arrives. So it reduces all that anxiety. So they're not walking in just scared to death. And with less anxiety, they're more tolerant. Okay? And create and maintain a welcoming servicescape. I'm sure in your classes you talked at length about the servicescape, right? You know, the visual design, the colors, the aromics, right? Hospitality, we're great. Every hotel seems to have a smell, or they have a certain type of music, right? The soundscape. Wayfinding, how do we get our way around? And so in our book, we talk about all these different colors of psychology, right? You go into any kind of like a Best Western, a Hampton, or anywhere where breakfast is included, there's always yellow, right? Because yellow is all about optimism, energetic. I'm going to start the day doing a great day. And then, you know, all these different colors put us in a certain frame of mind. And what I want you to think about when you go to a doctor's office, or if you walk into a hospital, think about the colors you're using. Are they really doing anything to improve the servicescape? And I would argue that they're not, and there's huge opportunity in this space, given your basic understanding of hospitality. So that's the anticipation. The next thing we want to do is engagement. Okay, so it's basically training to interact with our guests like we do in hospitality, right? Teaching our team members 14 key words of service. So my friend Ed Mady, he was named as the hospitality executive of the world a few years ago. Longtime Ritz-Carlton guy, ran the Beverly Hills Hotel for many years, which is part of which collection? The Dorchester collection, right? So he trained all his people at the Beverly Hills Hotel, 14 key words. Remember me, that's 2. Recognize me, another 2. Anticipate my needs. Give me what I want on time. And he trained all his staff to remember those 14 key words as a way to improve customer satisfaction. And his scores were always top. And he dealt with very high-end people, as you can imagine, in Beverly Hills. Those 14 key words. You've all heard of the Ritz-Carlton 10-foot, 5-foot rule, right? When 10 feet away, make eye contact. When 5 feet away, say hello, right? We hear about that all the time on our side, but getting healthcare to think the same way. What we did at MD Anderson is we introduced an acronym that reflected our commitment to enhancing patient satisfaction, making people feel like loved family members. And what we did is we came up with what we called Anderson Care. So Anderson Care equals a loved family member. And we made these big signs and we put them all like in the employee dining cafeterias. We put them in the waiting rooms behind, where the staff were working. So when they came in to get to their seats, all this was behind there. And we had things like acknowledge, nod, delight, make eye contact, so that the staff, instead of just sitting down looking at their computers and the person walks up and they say medical record number, they were at least looking up and doing any one of these things so that they could easily remember what to do. Okay? And so thinking about these kinds of things, applying them to healthcare. And then, when possible, presenting patients with a final bill that explains any variances from what they received in advance. Okay, so say, here's your final bill. Here's where the difference is going to be from what you might have thought. Ideally, we do that before they arrive, but also give it to them when they're checking out becomes important. It's a way to engage. Communicating in layman's terms, not in medical jargon, right? All of these seems like knowledge, things that we would know in hospitality. Like when a guest asks about the room rate, we don't ever say, well, the rack rate is this, or our bar rate is this, right? Terms that we use, we talk about it, well, our typical rate on tonight is X. We don't use terminology that the guest doesn't understand. And then anytime we engage, we should use the rater system. You all know what the rater system is, right, from all your classes? The dimensions of service quality, reliability, assurance, tangible, empathy, responsiveness. Ring a bell? Right? And what do we use the rater system for? It helps make that which is intangible, tangible. We remind the guest that we're giving them great service, right? Because if everything goes well, the guest doesn't even notice. But when things go wrong, they notice right away, right? And remember, the GAP model says if guests are excited, if we exceed their expectations, they're happy. If we don't exceed their expectations, they're unhappy. But if we meet their expectations, they're also happy. And a lot of times we used to always believe we always wanted to exceed customers' expectations. But we don't want to do that, right? Because if we keep exceeding customers' expectations, we keep raising the bar, right? So what we want to do is equal their expectations, but then remind them we're giving great service. Does that make sense? When I was first married, every night I was at the hotelier. I turned down my wife's bed, put the light on, turned it down, put a mint on the pillow, put a little basket for her dirties, on the floor. One night it was really busy. I hear this, Stowe, Stowe. I go running downstairs, and my wife is like, where's my turn down? So when I got married the second time, I didn't tell my wife what I did. But so obviously I've only been married once. But the point is with that is you want to meet their expectations, but you let them know, and you do that through the rater system. And when I worked at MD Anderson, when I worked at other hospital systems, we spent a lot of time having staff develop different components of the rater system to show that worked. Okay, so that's the engagement side. Then, of course, we have the evaluation side. Okay, the provider tries to make me feel satisfied with the service I received. Again, healthcare is not doing that. Okay, and a lot of times we're not even asking. So in terms of evaluating, we do this great in hospitality, right? We have a very ongoing customer satisfaction survey. So what we need to do is implement ongoing programs to solicit and review feedback from patients on their experience within 24 hours of each visit, so we can really find what's doing well and what's doing not. We want to distribute that feedback, right, to everybody in the organization so everybody can see it, okay? And we also want to do a sentiment analysis, right? In hospitality, we're very good about doing sentiment analysis, right? We're out there searching the web, finding all the customer comment cards coming in, and we're hearing what people are saying about us, and then we're making changes based on that. So you're probably familiar with Medallia, which is a big data collection company, and they basically get all their data from structured and unstructured data, from message logs, website forums, all the feedback, and they provide all this information to some real hospitals that are doing very well, but also we get it all the time in hospitality examples, right? We don't do mystery shopping in healthcare, but we could, right? And so all this feedback becomes really important because it's a way to evaluate how well we're doing. Okay. And then the last is the reward, right? How do we reward patients for their business? Okay. And one of the things that we argue is that in healthcare, we have to start thinking about loyalty programs, right? Because for many people that have chronic conditions, if you have to have dialysis, people who have to have dialysis 2 to 3 times a week. They usually go to the same center, okay? If you're dealing with cancer treatments, you're dealing with a chemotherapy on a regular basis, right? So you shouldn't be treated like the first time you walk in, you have to wait in line and then tell everybody the same information. So by having a loyalty program or something, people are rewarded. We keep track of who they are. We know when they're coming. And when they come in, we recognize them and we put them immediately to where they need to be in terms of having to have them wait forever, right? We're very good about doing that in hospitality, but not so in healthcare, okay? Again, we're not very good about thanking them for their patronage, right? Thank you for coming, and again, rewarding them. And then one of the things that some hospitals are doing is they have what they call patient advisory councils, okay? Which basically saying, let us be a patient advisory council. Tell us what we're doing well. Tell us what we're doing poorly. We'll reward you for giving us your insight. All of these rewards are a way to let people know we want their business and we thank them for their business, okay? One of the things I learned at MD Anderson, which was sort of really hard to understand, but it's true in any hospital. Thank goodness one of the cancers that we've done very well at taking care of is breast cancer. So many hospitals across the U.S. have put in breast cancer clinics where they encourage women to come in for their annual mammogram, okay? Well, if you think about it, as the hospital, they bring the mom in for her annual mammogram. She has a great experience. Then all of a sudden she has to take her children in. She's going to remember that hospital. Oh, they took me great when I had to go in for my mammogram. Now I'm going to take my kids there, right? Oh, and my husband has an issue. I'm going to take him there, or my partner, right? So suddenly now they're saying, oh, we have a customer. Now that customer is going to give us a lot of other customers, and we're going to make revenue from that, right? We're very good about that in hospitality, right? Of getting repeat business, making sure we invite all members of the family to take care. In healthcare, we have not done that very well. So that's an example of reward. So essentially, this again takes us back to the payer model. And what we argue is that if we prepare, we anticipate, we engage, we evaluate, we reward, then we're going to end up with long-term customer satisfaction and long-term loyalty. Does that make sense? Can you see stuff you learned in your hospitality classes, how this can easily apply in the healthcare situation? Okay, but again, it hasn't been happening. And that's why, all the research showed that it hasn't been happening. I've just showed you a way to think about how you could make it happen. Okay? And in each of those areas, engagement, etc., would be a whole dissertation or a whole research project in terms of what are the different ways we can engage our employees. Okay? Any questions at all? And I'll tell you some stories about how some of this came about. Yes?
Thank you so much for the insights. That was really interesting, and I didn't know much about that, so it was cool to hear about that. So what efforts are you and maybe the team at UNLV taking to actually get these initiatives into hospitals in different places and educating the healthcare system about these efforts that you researched?
So great question. So I've done seminar. So at UNLV, we just started a medical school. So the dean of the medical school bought 60 copies of my book to give to all his staff. They're basically looking to create a clinic at UNLV for low-income guests or patients within Las Vegas. And they want to incorporate many of the principles of hospitality into healthcare into this clinic. They hired consultants out of Houston who are architects. I'm going down to Houston next week to meet with these architects to talk about these principles. I'll be frank, I'm no longer the dean of the hospitality college, so I don't know what the new dean wants to do within hospitality for this, because as academic institutions, every curriculum is driven by the faculty. But I have been talking to the medical school about maybe doing a course within the College of Medicine along these lines. And we've certainly been talking to some of the major health systems about implementing some of these processes. Like at Baylor College of Medicine, I spent a whole day with them. They took my book, they took the payer model, and we incorporated every component of the payer model to everything they did along the guest journey. So it's happening at systems like that. But it's a slow process. Because hospitals are all saying, we don't have any money, we like this idea, but we don't have any money. And so it's going to, all good things take a long time. It's like I remember when I first started doing stuff in loyalty programs, people were like, who cares? When I started doing stuff in revenue management, people were like, who cares? Now people ask me to give a talk on pricing, and I'm almost embarrassed because the articles I wrote were years ago, but now suddenly people are paying attention. I think it's the same with healthcare. And doing talks like this, getting you guys in hospitality, realizing, wow, I could have a great career in healthcare, we're seeing the trend start to happen. But people are buying the book, and at least they're talking about it. So that's what we're doing at UNLV. Yes?
Obviously, we're all from different cultures. Therefore, I'm from Germany, and healthcare in Germany is way different than in the US. I was thinking maybe there's this trend that healthcare actually happens in hotels, or this kind of trend with wellness and so on. Do you study about it as well, or is it mainly like the US and how you make it more hospital because you basically have to pay really, or the hotel the hospitals really they depend on the customers more than they, for example, do in Germany, because usually it's covered by insurance and so on.
Well, so great question. And really what's happening in other countries is you see a lot of countries developing what was being called medical tourism, where people will travel from one country to another. Poland has spent a lot of money. Thailand spent a lot of money. Saudi Arabia is spending a lot of money to bring people into their healthcare. So if I'm a patient in country X and I don't feel I'm getting the kind of service I need, I'll go to country Y to get that. And so I think the way to think about it is do we have some specialties in our area as a way that we can bring people in? And then when they're with us, how do we make sure that we're doing a great job? So even though insurance is paying for it, as there's competition among hospitals, There's competition among doctors, right? So the issue becomes is, yes, it's being covered by the government, but at the end of the day, I still need to make money and I need to cover my costs. So if I can get word of mouth to get people to come to my hospital versus another hospital by implementing hospitality principles, then it becomes a win. Does that make sense? And even in a hotel, right? If you have a hotel near a medical facility, like if you look at MD Anderson, there's a lot of hotels all taking care of people who are coming to that hospital. So that means I have to understand what are the conditions people come to, how do I make sure our rooms and all that are accessible for that type of patient. I hope I've answered your question. If not, we can talk afterwards. Yes. Okay. 7 and then over here.
Okay, thank you. And may I ask, so because I think the technology, especially in the medical, is very, I think it's very complicated. And now we are also doing like the online results or this kind of thing. So do you think because in the hotel, what we can do is like we will talk to the customer by face to face, maybe the results or maybe some situation occurs. So about this technique innovation, is it can influence like the hospitality feeling, like the care, like the result is the whether it's the doctor told it to you or maybe show it on a website, which is very cold. So how could you balance these two?
So what's happened, so I'll give you a good example. So with MD Anderson, when my friend Marco was going through all his treatments, we would get a detailed analysis. Here's what your visit, here's the visit, here's what all the results suggested. When he had to meet with his doctor, sometimes that meeting was, because he was in Las Vegas, it would be over Zoom. So we use all types of technology to connect the doctor to the patient, and we provide multiple methods to get that information to the patient so they don't necessarily have to physically be there. Okay, so we do use technology a lot to make it easier to understand. There's a company that will basically take a radiologist's report, run it through AI, and turn it all into English. It's all in English, but turn it into layman's terms. So yes, all that technology is around. Because at the end of the day, yes, healthcare is different in different countries depending upon who pays for it. But at the end of the day, we always have a sick person dealing with an expert. And how do we make that relationship work? Hopefully that answered your question. We had a question over here. Yes, table 3. Was it table 3?
Hi, thank you for coming to speak with us today. My question is it's a little off topic, but I'd be really curious to hear your opinion on it. So we have started to see hospitality in many different sectors outside of the traditional sense, like real estate, athletics, and now as we most recently realized, healthcare. So in your opinion, what do you think is going to be the next area where we are going to see hospitality, or how is hospitality going to evolve to, go into these new sectors?
So the key thing is, at the end of the day, we want to move people away from buying things online, and everything's all about creating great experiences. So if I work at a fashion brand, right, it's not necessarily buying the clothes, it's the experience of buying those clothes. So if I'm, just like the program they're doing here at EHL with the fashion house, how do I create events to get people into my store instead of buying stuff online? So I think hospitality, I'd hire somebody who understands events, party planning, event planning, organizing, creating great experiences. I think that's a prime example. As mentioned in the restaurant where they go search online to find the picture of the pet, to put it on there. Understand, as hospitality, we understand what it means to create a great experience. Any business that needs customers and wants to extract revenue from those customers, they're going to look for hospitality people to figure out how do we take that money out of their wallet in a way that makes them feel happy so they come back.
So you were talking about the servicescape in the hospitals, right?
Yes.
And I was specifically thinking about just like smell, that it should have like a nice smell, like hotels often do.
Yes.
Makes perfect sense in hotels. I'm just wondering in hospitals, when it comes to like allergies and these kind of things. So did you meet any like complications when you were studying this or when you were pitching this to different hospitals?
No, because, I mean, essentially, you think about in the same situation, when people go into hotels, we have the same allergies. People are always coming in. So the question is, you design scents that don't create things that are really problematic. And it depends where you have the scents, right? So I have not done any research on different scents on different allergies. But if you think of what we do in hospitality, everybody comes in and everybody has some kind of allergy, but no one that I'm aware of says, oh, I can't stay at the Westin because the smell makes me sneeze. I think they've picked senses that are neutral enough that they're not overpowering, but they're not allergenic. And that's the way I think hospitals do, especially in waiting rooms or certain areas. So that's not a very good answer, but that's the one I can give. But it's a great question. And do we have time for one more question? And I'm going to be around, so you can always ask me questions later. But these questions are free. The other ones I have to charge for. Yes. I'm not kidding. No, I am kidding, obviously.
In your opinion, do you believe that healthcare tourism is a positive trend, or do you think countries need to address and review policies in their hospitals systemically first before being encouraged?
So it's a dual thing. People will look for medical tourism as a way to bring revenue into the country, right? In order for revenue to come into the country, they have to have healthcare. If they're doing medical tourism, they have to have things that people will travel for. So that means they have to develop an expertise. So by developing that expertise, then that will improve the healthcare for the local community. And I'll give you a good example in Las Vegas. So Las Vegas, before I became dean, we looked at medical tourism as a way to help improve healthcare. With the idea being, if we become an expert in certain areas, will that bring people into, like, for example, sports, okay? Las Vegas is becoming a big sports town with professional football, professional soccer, etc. So they're looking at putting in an orthopedic clinic because we have a lot of athletes, Cirque du Soleil. We become experts in that area. Now, I'm not an athlete. I hurt my knee. Well, we have doctors who are training Cirque du Soleil actors, professional football players. I'm going to get better service because we have the expertise there. And then because we have the volume, doctors will come in because they know they can make the revenue. So it happens simultaneously. But if there's no incentive for a hospital to get better, they're not necessarily going to get better because the cost systems are so high. And that's why countries are really focusing on medical tourism, because that it improves the infrastructure locally to make things better. Okay, thank you I hope you found it interesting, very different than kind of other things we've talked about over the last couple of days. But I appreciate you letting me talk about hospitality and healthcare. And we have a website, hospitablehealthcare.com, which has interviews. We did a lot of it. We taped the interviews that we did, so we have little clippets of all that. We have all the data from the book and all that kind of stuff. All right? So thank you.
Thank you.
Thank you.
Great.
Thank you again, Dr. Stowe Shoemaker, for sharing your expertise and insights with us.
I really loved it, and I would love to see what all of you delegates thought about it too.
Dr. Stowe Shoemaker is here to answer all of your questions, but do you know what's the best condition to do it?
A coffee?
Exactly. We're going to take a coffee break afterwards, but before the coffee break, you will have some time to work on your challenge. You have around 45 minutes, and you can find any workspace around campus, but please do not go to any classroom. And the coffee break for you will be at the balcony at 4:35.
Then after that, we'll all meet back here at 5:30 sharp. Please be on time for the dynamic pricing panel. Then we'll do a game of Family Feud after, and then our day together is over. But we'll see you back here at 5:30. Thank you.